elaborately understand the generations of intrauterine copper devices, I have just put here a collection of contraceptive device. So this one was the SAF-T. This one was known as the SAF-T, which one was one of the first T-shaped contraceptive devices. These are inert contraceptive devices, just like your Lippis loop. You have all seen Lippis loop, right? And these are made of celastic materials with a thread in but no active substance or no metallic substance. So one particular such device that I would like to specially talk about is this one. This is an intrauterine contraceptive device known as the Dalcon Shield. Dalcon Shield, right? So Dalcon Shield was, can see this with these areas, they can anchor inside the uterus, but they also cause severe trauma and infection, and many of the women died of sepsis. So this is not a barrier contraception. This is an intrauterine devices which was most associated with infection and sepsis related death of women and was taken aback, right? So these two are first generation or inert contraceptive devices, and the second generation of contraceptive devices came with copper. So this one is copper 380A, copper T380A, and this one is the 375 multi-load. These are not very obscure ones. These are actually the two currently IUCDs that is being supplied by the government of India. So this one has copper on the arm as well and on the body, right? On the arm and body, and that's why the A, because this has copper on its arm, so it is called 380A. It is not silver containing. Don't have this misconception. It is not silver containing, and it is A, not Ag, right? It is not A, it is A, not Ag, and A is for arm. Note that rounded blob end at the end, which is done to make it to prevent perforation. Look, here also blob is there. So this is done to prevent perforation, that the end doesn't perforate. Total surface area of the copper is 380 square millimeter here and 375 square millimeter in this particular device. So the number you understand is the number which is the total amount of surface area in millimeter square of copper on the device. So this device is called multi-load, and this is 380A. This one stays for 10 years and this one is for 5 years. This one is a 5-year device, right? So this one is more popular for spacing. Spacing is when somebody has one child and want to delay the next pregnancy for next 3 to 5 years, say. So for spacing, this one is more preferable, whereas those who want a long-term contraception but doesn't want to get permanently sterilized because of several reasons, for them this one is a better alternative. So both are Government of India supplied intrauterine copper devices. Now let us see this one. This one is a band contraceptive device which is known as Progestesart. Progestesart was the first one containing a hormone containing contraceptive, which is also, these two are first generation, right? These two second generation. So this is a third generation which contains hormone instead of copper, and Progestesart was to be implanted for 1 year. So because of the short duration and very much increase in ectopic pregnancy rate with use of Progestesart has been taken out of the market. Now what is being used in the third generation is Mirena. Mirena is a levonorgestrel containing intrauterine system which stays there for 5 years. There are Emily, Erina for 3 to 5 years. All of these are third generation pills. So let us discuss a bit more on the intrauterine contraceptive device. So what is timing? So there is one thing is post placental IUCD. So it has to be implanted immediately after the birth, within 15 to 20 minutes, 10 to 15 minutes of the delivery of the placenta. 10 to 15 minutes after delivery of the placenta, if you put the copper T by no touch technique using this particular instrument called Kelly's forceps. Kelly's forceps. See this looks like with serrated ends. This looks like ovum for this looks like sponge holding forceps, but see there is no catch, no catch. You can confuse it with ovum forceps. See the carve, and it is also a bigger instrument. So this is Kelly's forceps that is used for introduction of post placental forceps by no touch technique. There is another thing called postpartum copper T insertion, which the copper T is inserted after within first 48 hours, within first 48 hours of delivery. Within first 48 hours of delivery, it is postpartum IUCD, postpartum intrauterine copper device, or PPIUCD, which is implanted within 48 hours of the delivery. So if you cannot motivate the woman within 48 hours of the postpartum period, we have to wait till 6 weeks. We have to wait till 6 weeks. We have to wait till 6 weeks after delivery, after which we can introduce a copper T, which is known as interval IUCD. Interval IUCD, right? Interval IUCD. So, what are the contraindications of copper T? Contraindication of copper T is, first of all, copper related contraindications. See, Wilson's disease, right? This is rare, but this has been asked repeatedly. So, Wilson's disease. We are introducing something from outside to inside of the genital infection, genital cavity. So, some genital infection, any genital infection or PID is a contraindication for copper T. Also, if somebody is having an active pregnancy, this is one absolute contraindication for copper T, obviously. Undiagnosed vaginal bleeding, where we do not know what is the source of bleeding. In undiagnosed vaginal bleeding, copper Ts are generally not introduced. What I want to emphasize is history of PID or history of ectopic gestation is not a contraindication, not an absolute contraindication for devices, right? So as you can see, all these copper devices, they have a thread attached at the end. So this thread basically protrudes around 1 centimeter below the cervix. So the woman, when she is taking bath, or she can put her finger inside and can feel if the thread is there or not. It is advised to every woman that she should check the thread once in a while, once in a week, or at least once every time after she has her period. Because if the thread is not there, which signifies that what could happen, the copper T would have gone out with sometimes it has been expelled and she must have missed it, right? As sometimes it can go out with the bleeding of the menstrual bleeding. So missing thread always means that a copper T might not be in the position. In the best case, the copper T is expelled out of the body, and the worst case, only the thread has come out and the copper T has gone inside the body. It has perforated the uterus, so this can happen. So once some woman has comes and complains of copper T, a missed thread, what is the first next investigation is, first you have to do a clinical examination and confirm, because sometimes the thread may be so small or it can get coiled upwards, so the woman is not being able to see it on her own or feel it on her own. And after clinical exam, the next first investigation is a TVS. We have to do a TVS to understand the exact position of the copper T. Previously, it was said that the X-ray has to be done in epi and lateral view with a sound or a metal device inserted inside the uterine cavity. So we know that where exactly is the copper T is in and where exactly the uterus is, but those are old generation answers. Now if you are asked this question, the answer is TVS, a transvaginal sound, so that we can see the copper T whether it is there or not, and if we can see the copper T, where is it? Is it within the uterus, is it outside the uterus, poked into the uterus, perforated, whatever it is. So let us see a few atypical properties here. I have kept the images, so these images are not asked. See this is a copper T, right? See the shape here, this is bent here, right? So in the previous image you saw that this end is globular to prevent perforation, but these ends are not. This has projected ends, right? So perforation is always a risk, and to prevent that, the ends are bent in this particular copper T, and this one is known as CU safe, not to be confused with SAF T. This is CU safe, and this is a 375 copper T, okay, 375 square millimeter surface area. This one, appreciate the color is very different from a copper T, okay. So this one is absolute silver containing copper T, this one is a silver containing copper T, which is known as the silver lily. This is a silver lily. Note the smooth curved arms without any metal attachment and the color of the metal, right? This is silver lily. This is the most modern intrauterine copper devices that is currently being used, and these are copper rings that are mounted on a nickel titanium frame. The frame is a nickel titanium, it's a malleable frame. As you can see, it is not a strict frame, it's a malleable nickel titanium frame, and activated copper blocks are attached with it. So 1, 2, 3, 4, 8, 9, 10, 11, 12. 12 copper plates are attached to it, and this one is known as Veracept. This one is known as Veracept NITI, right? Gold is also being used. It's known as gold T, simple to remember. So this is the gold T, and gold is also being tried as an intrauterine contraceptive device and used, approved quite successfully. So let us look at the mechanism of action of intrauterine copper devices. So these copper devices actually make the endometrial bed hostile for implantation. So implantation prevention is the main mechanism. For all intrauterine contraceptive devices. When we are using hormonal devices, it can also cause out of phase and atrophied endometrium or pill endometrium, preventing implantation, and might have some effect on ovulation. But most important mechanism for any intrauterine device is implantation prevention. So do copper Ts increase ectopic pregnancy or not? Remember, it's a concept I would like to emphasize here. Remember, the copper T reduces total number of ectopic pregnancies, right? Copper T reduces total number of ectopic pregnancies, and then there is another statement, copper T increases. Copper T has a higher, implanted copper T has a higher risk of ectopic pregnancy. So both this sentence, however contradictory it sounds, are correct. So because copper T is a contraceptive device and the overall rate of pregnancy is coming down, the overall rate of ectopic pregnancy is also coming down, that is true. But when there is a pregnancy with copper T in position, it has a higher chance of being implanted abnormally, as copper T renders the endometrium unfit for implantation. So the chance of ectopic is high when pregnancy comes with copper T in situ, when pregnancy comes because of copper T failure. But that does not mean that Copper T increases the total number of ectopic pregnancies. Since total number of pregnancies are cut down by use of copper T, obviously total number of ectopic pregnancies are also cut down. So, these two sentences, these are not contradictory. So, let us see one more generation of copper T. These are called the frameless copper Ts, which are introduced hysteroscopically inside the uterus and anchored on the fundus, and this one is called gynafix, frameless intrauterine copper devices. These are anchored to the endometrium. Can you see the knot? This is anchored to the endometrium near the fundus. So, this is the hysteroscopic view. This is a hysteroscopic view of a gynafix in position. Talking about the hysteroscopy, previously one method was also being used, which was known as Assure device. The Assure device, which was as a silver molybdenum ring or a screw was introduced hysteroscopically on bilateral cornu. So, it goes into the cornu, causes severe inflammatory reaction and blocks bilateral cornu. This was one of the most irreversible method, but because of severe pain afterwards, severe inflammation and severe pain afterwards, this is withdrawn from the market. Adiana is the same thing, but instead of this silver molybdenum ring or coil, we could use any inert substance like even rice husk, can be introduced to the cornua through hysteroscope, and it would cause the same inflammation and bilateral cornual blockade, but these two methods are withdrawn because of severe pain in most of the women, right. So, after the discussion of all this, let us go into the pills.